Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Sahana Devdas. She was professor, head of the Department of Pediatrics in Vani Vilas. After retirement, now she is continuing her services to the society from the BGS Hospital in Bengaluru. She is the awardee of 2021 State Lokayukta Award and then FNNF Award 2024 and first Golden Minute Appreciation Award in 2021. And she is a very dedicated pediatrician, and we will welcome Dr. Sana. Welcome.
Thank you so much, ma'am. And I'm so happy and honored to be in this channel of yours. And madam was a very good teacher and a mentor to all of us. Yeah, thank you, ma'am.
Thank you so much. Thank you so much. And now you are having the breastfeeding week. What is this breastfeeding week and when it was started and what is the significance?
Yeah, thank you, ma'am. Now, every year, August 1st to 7th is celebrated as World Breastfeeding Week, ma'am. This already started 35 years ago. So, every year there will be a theme. Every one of us know that breastfeeding is the best. But still, we are lacking and early initiation of breastfeeding. Every baby's right is to feed within 1 hour of birth, whether it's a normal delivery or a cesarean section, even if it's a preterm also. So this is not NFHS data 6 says that almost it was 40.7, now it is increased to 50%, but still another 50% is not doing, and exclusive breastfeeding has to be done till 6 months and continued breastfeeding till 2 years and beyond, in addition to for the optimal infant and child feeding practices. So this exclusive breastfeeding rates was 63.7. It has come down to 55.8. It is a sad thing. Everybody knows, but it needs continuous protection, promotion, support.
Awareness. Yes.
Yeah, so this is what we do, awareness. And this year's theme being breastfeeding for a sustainable start in life. For that is every right of a baby to have a sustainable start in life and strengthen what works. For each hospital, something works. So we have to be all of us together. If we can do together, it is better. It is not one person cannot achieve.
Yeah. In the past, the mother and the grandmother, they used to help the woman who was delivered. But now in a nuclear family, nobody is there. So the doctors and nurses, they have to pitch in and then come for the support. Now, tell us the importance of breastfeeding in the first hour. Even whether she is a cesarean section, whatever it is, but still we insist. Why is it?
This is because it saves 1 million lives, ma'am, newborn lives, by feeding in the first golden hour. Okay. So, and we have why this 1 hour skin to skin has to be given is there are 9 instinctive stages. Baby doesn't come out. Baby is also stressed out. So there are 9 instinctive stages are there. By the time baby starts suckling, there is a breast crawl. Beautiful video is there done from our. So you can just see how baby crawls towards the breast. Okay, that takes around 40 minutes or so, average. Another 10 minutes, you have to allow the baby to suckle. So that's why that golden hour, and mainly it prevents hypothermia, which is a very dreaded killer.
Yeah, because then, it is so warm and nice, and the mother also gets the feel-good hormones. No, oxytocin is released.
Correct.
She's also happy. The baby is also comfortable.
Baby also happy. And baby will be active. Later, baby goes for a long sleep. Then the baby mother also will be tired. She will sleep. So that time we have to mainly utilize, that gives the best results when we do that. So all babies should be breastfed within that first hour, ma'am. And again,
that is the one, which causes a layer in the intestine, and the immunization is also best.
First immunization, yes. It's called a liquid gold, cholesterol. Even few drops, it will be of a size of only our thumb, the stomach capacity. So that even few drops is thick. Liquid what we get has to be given to the baby as early as possible, ma'am. So that's what we are supposed to do, and that's this time's theme also is like protect, promote, and support breastfeeding. Antenatal care itself, we have to emphasize on what are the benefits, how to breastfeed, what are the precautions they have to do, like that. So we never separate in our hospital for 1 hour. Even weighing should be done after 1 hour. Even that
Okay.
injection vitamin K, hepatitis B after 1 hour. We
Yeah.
cannot take the baby, show it to the attenders. No, 1 hour.
No. Okay.
Mother's chest is the
First,
best
it is
place for the
mother
baby.
and the
Yeah,
baby. Have them the
baby.
comfortable to themselves.
Yes,
And now,
yes, and
what
it
are
is
the
at
benefits of this breastfeeding to the mother and to the baby? What are the
yeah.
benefits? Please tell us.
So, like in the labor room, if we do that, mother gets benefited because she is
Hmm.
at risk of postpartum hemorrhage after the
Hmm.
baby is born. So it
Hmm.
protects against PPH, and then oxytocin release is there. It helps in the uterine contraction, and all
Hmm.
her love hormone or oxytocin is a love hormone, what we call
Hmm.
that gets, which is for the helps for the ejection of the milk.
Hmm.
And if she is
Hmm.
hypertensive, her breastfed, stress also comes down, pain
Comes
also
down.
comes down, and she will
Blood
have a
pressure comes
confidence,
down.
ma'am. She will
Hmm.
have a confidence, that
Yeah.
mother baby bonding also happens to the mother.
Along with the
And
confidence, she'll have the comfort and then the
yes,
pleasure. The
yes,
satisfaction will be
pleasure.
there. Yes. Yeah.
Correct. Satisfaction
Yeah.
and exclusive breastfeeding rates are more. It's already proven, evidence-based
Hmm.
medicine by the Cochrane, that those mothers who are given within 1 hour and skin to skin given, exclusive breastfeeding rates are more in those babies. I
Okay,
mean,
okay.
mothers and the
Now, what
babies.
are the
Yeah,
other benefits to the mother? See, many
yeah.
people think that by feeding the
Correct.
baby, they will lose the figure. Is that true or
Figure.
it is a myth?
No, it's a myth, ma'am. So they will lose that extra calorie they have put on during the pregnancy,
Hmm.
and because giving milk, they will be sweating and so many things. So they
Hmm.
will lose the extra calories and they'll come back to the normal shape. And
Hmm.
again, it acts as it's a
Okay,
natural contraception instead of the
okay,
copper teas and all that. If she's only
okay,
exclusive breastfeeding, if she's mixing,
okay.
difficult, and it reduces the risk of breast cancer is rampant now, and ovarian
Hmm.
cancer also, and her
Ah.
obesity and heart diseases, diabetes.
Also, will add by feeding, the mother as well as the baby gets the benefit. What extra benefit the baby gets?
Yeah, baby gets complete nutrition, ma'am. That's the
Hmm.
best food baby gets. So it is
Hmm.
easily she can convenient
Tailor made,
everywhere. She
tailor
can
made
different
for
food.
that baby. Yes,
Tailor
yes.
made for that mother, that baby. It's the
Hmm.
mother's own milk, what we say,
Hmm. Hmm.
and baby gets complete nutrition. And again, it protects because lot of immunological properties are there, like lysosome, IgA, secretory IgA, then human milk oligosaccharides, lysozymes are there.
Hmm.
So white
Hmm.
cells are there. So that protects against infections. Mainly,
Hmm.
children die by pneumonia and diarrhea, so that will protect against major disorders, and
Hmm.
again from allergy, asthma,
Hmm.
eczema, and long-term non-communicable diseases like obesity, diabetes mellitus, hypertension, and cardiovascular disorders. It
So
protects.
the future diseases are also prevented.
Yes,
So
and
the
the
baby is
babies will get
prepared.
better
The baby
IQ.
is prepared to be
Yes,
strong and well
yes,
being.
and
Yeah.
baby's intelligence also is better if they
Yes.
continue till 2 years.
Breast
Yeah,
milking. Okay.
IQ.
So the
Yes,
breast
IQ.
milk makes the baby not only strong, mentally also strong.
Mentally,
Okay.
yes, ma'am. Yeah.
Now suppose the baby is very small, it is a preterm, and then it doesn't have the strength to suckle. In that case, how do you manage?
Yeah, good, very good question, ma'am. This era of 2026, mothers are all, they want double graduate, triple graduates. Yes, it is good, but their marriage itself is delayed, and lot of IVFs are coming into picture. So
Hmm.
more premature deliveries are happening.
Hmm.
So preterm deliveries are about 30 to 40% of the children are preterm one.
Hmm.
So for this, these babies will be taken care by the NICUs.
Hmm.
So even there, we emphasize with the baby, we would have already told them during the antenatal period itself, and the pediatrician or the nursing team from the labor room or the OT, we would have
Hmm.
collected the utensils, sterile utensils. They have to express the milk from the mother, and along with
Hmm.
the baby, that has to be brought. So
Okay.
every 2 hours, 3 hours, 6 to 8 times, if she's pumping, ma'am, that will
Hmm.
only increase the mother's milk. So that will be given in the NICU.
Hmm.
So one more thing is at zero separation for now IKMC. There is a one new study, immediate KMC, kangaroo mother care, again for these small babies, and this has reduced the mortality 25%, of the
Okay.
neonatal mortality, early neonatal
Okay.
mortality.
Okay.
And increasing KMC hours will improve the mother's milk
Okay.
and
And what
pumping.
about
And
this
suppose,
breast milk bank?
yeah, if the outborn babies are there, we don't have enough. The less than 1,500 grammar, less than 32 weeks gestation, these babies
Hmm.
cannot suck, swallow, coordinate. So that's
Hmm.
the reason we can. Second option, mother's own milk is the first option. Second
Hmm.
option is pasteurized donors human milk, ma'am. So we
Hmm.
have about 12 human, that is comprehensive lactation management units. One
Hmm.
such was started by us. I gave the name as Amrutadara in Vani Vilas in
Hmm.
2022. On March
Hmm.
8th, we started. Like that, all over Karnataka, we have 12. Private also it is there, but government district hospitals and medical colleges, we have a CLMC. So not only
Okay.
storing that, we help the mothers also in lactation, ma'am. So you
Hmm.
can just choose from there for these preterm babies. If the mother has not come or till the mother is okay, we take
Okay.
this as the
And
second
in
option.
fact, when the children have got underlying heart disease, they have suck, rest, suck cycle. They
Yes,
suckle
ma'am.
a bit and then just go to sleep because they're tired, and again they get up and start drinking. That is an
Yes,
indication that they have got underlying heart disease. And one of my
correct.
patient, just 4-day-old baby with the
Okay.
cooptation, I had done the balloon dilatation, but the mother had undergone cesarean. She was there in the Kolar Medical College. So I made
Oh,
another woman who was already having a baby to feed this baby also.
yeah,
So, a mother can feed not only one, the other children also.
correct.
Now,
And wet
yeah.
nursing, what we call.
Yeah,
Yeah,
vet nursing. Yeah,
correct.
vet nursing.
Yes,
Yeah. And
yes,
this has been known for ages in India, and they used to choose the clean and the best feeding mothers, nursing mothers for nurse the others, especially if the mother is no more and she has died, they used to use that.
correct.
Now, yeah.
All our
So,
grandmothers and all used to give, ma'am. They keep
yeah,
telling.
yeah, grandmothers
Dodama,
also. No
yeah, and
nipple
my
was given.
aunts,
The grandmother used to give her nipple.
correct,
That's
correct.
true.
It was like
Correct.
that.
Now, finally, what is the advice that you would like to give on this breastfeeding week?
Big. Yeah, mainly, ma'am, it is not only we can't ask the mothers feed. So they
Hmm.
need continuous support. It has to start from antenatal only, like
Hmm.
good nutrition, good sleep. Because there are studies, if mother is not eating well, less sleep, less production. And she
Hmm.
should not worry that no milk, no milk. Even twins can be given breast milk, one
Hmm.
breast for one baby.
Hmm.
That's what even now I have 2 or 3 pairs of twins. They are doing like that. That is enough. The
Hmm.
more they feed, the more milk production, like
That comes. Yes. Yeah.
Akshay
Comes.
Patra. Yeah, so
Hmm.
all mothers should feed within first hour of life. That is that golden hour, and especially colostrum feeding. The
Hmm.
initial part for 2 days or 3 days, which is there, has to be given for a
Hmm.
strong foundation, and exclusive breastfeeding for 6 months, and continued breastfeeding in addition to the other complementary foods till 2 years and beyond, ma'am. This is my humble request to make our country, like even it is eco-friendly also. Even it is
Yes.
good for the future, nature, every mother, every baby, we need to support. Yeah.
Wonderful, wonderful. So the mother, baby, both are safe, and the nature also is safe. So thank you
Yes.
very
Yes.
much, Sahana, for putting
Thank you,
so
ma'am.
beautifully. Thank you.
Yeah. Thank you so much, ma'am, for the opportunity. Thank you.